quality of life, a satisfying, healthy quality of life. Please, from my side.
Sir, a few words from my side. Actually, very rightly said. What we have been doing till 3 decades back was chronological age, the age which we have in our date of birth or certificates. Then we developed a concept of biological age. Ideally, they should be equal, but they can be different. We can be chronologically 30 and biologically less than 30. Even those who are 70 plus, they at times are less than 50 by their biological age. We have even advanced to arterial age, bone age, brain age. So quality is the one which has to be there, and we will listen to the legend about how to stop biological aging. Chronological we cannot.
Thank you, Chairpersons, Dr. Arun, Dr. Sanjeev, Dr. Kalra. I think I'm very honored to be here, and I address friends and friends of the fraternity. We all got engrossed in our specialities, which we have chosen, pioneered and mastered, and we assume that we are assured immortality. Many times people ask me, oh Dr. Mani, we know we are all getting old, but why waste a nice Sunday worrying about aging? Fair enough. But believe me, the worry of aging has been in the mind of each one of us sometime or the other. My talk is only a curtain raiser to welcome senior living in comfort with minimal unpleasant surprises. Why does age slow us? The picture on the left is that of an infant full of life whose eyes are wide open to discover the new world he has come into. The picture on the right, the sleepy old man wants to rest and slow down. The reason is, as we age, the microcapillaries shrivel, making less oxygen available to our body. This, along with our attitude of self-pity, makes us opt for an easy life. When we don't exercise, we lose muscle power. As you can see, muscle power is the main thing. If you have muscle power, you have microcapillaries growing. If you don't have, then you go into the state of methylation of the DNA. And this is the fatigability, and that's the reason there is less energy in the cell. And that's what aging is all about. What is the genetic basis of aging? Genetic basis of aging is that the genes bear the brunt. It gets a signal that since there is no fresh energy coming in, let me curtail my energy requirements by reducing the length of the telomere and histones modified by epigenetic factors. We trigger off methylation of the DNA. We end up with our health endpoints of cancer, diabetes, mental disorders, autoimmune disorders, all because we allowed our DNA to get methylated. Aging really begins in the 40s, where we ignore the deleterious biological changes that are naturally occurring in the body thanks to the stress of competitive life, money-centered urban life, etc. Stem cell turnover, cellular senescence, inflammation. I will be talking more about inflammation. Protein translations and autophagy lead to cellular senescence, and this is what aging is all about. What does aging do to us? We say age is a number, as Dr. Arun just now told you, age is a number. But we practice our lives differently. Fatalistically speaking, we accept that we should all have diabetes, we should all have cardiovascular disease, we should all have cancer, we should all have Alzheimer's and stroke and autoimmune disease, but that doesn't happen. Some of us do get it, some of us don't. And what's the secret? DNA methylation and shortening of the telomeres. Now, programmed aging is different from programmed cell death, which is apoptosis, which we are all very familiar with in myocardial infarctions. Atherosclerosis is classified as the aging disease. It causes heart disease, stroke, by loss of elasticity, leading to thickening, narrowing, occlusions, or degeneration of vessels. Genetic changes in the genomes cause diabetes and also cancer. All this I acknowledge to a certain book that I read upon, and that is what the stimulus to give this talk. The book is called The Life Force, written by Tony Robbins, and I also happened to visit the Fountain Life, New York, where I had this lecture by Dr. George Shapiro, a renowned cardiologist. The facts about atherosclerosis: we believe that we have made a lot of progress, including me. I believe that in the 44 years of cardiac surgery that I have done, I have greatly contributed to humanity. But have we? In the last 50 years, we have failed to impact the world's greatest killer. Sudden coronary death rates have seen no improvements for the decades. 25% of people will die of myocardial infarction. 48% people will have coronary artery disease. And 50% of the people will get their first MI, and that will be their last MI. So did these four people whom you are seeing in the pictures down below. Lal Bahadur Shastri, we all know, the second Prime Minister of India. Devang Mehta, a businessman. Raju Srivastava, the comedian. And Krishna Kumar, the great singer. All of them had heart attacks which could have been prevented. 90% of heart attacks are preventable. Now, we talk about atherosclerosis when we become 40 and 50. But atherosclerosis really begins very early. Now, this is a random research done on 300 autopsies in the Korean war casualties. And they found that 77.3% had coronary atherosclerosis and 39% had occlusive plaques in soldiers who fought dying in the Korean War. You can see the soldiers are supposed to be fit people, and this is the amount of atherosclerosis that is already there. So we have to shift. There has to be a paradigm shift from reactive to proactive. Now, as you can see in the diagram, normally we treat the sick. That is what healthcare is all about. That is what Delhi Medical Association is all about, treating the sick. But is this where the issue is? The issue is that if health-related issues start in the healthy period, should we treat the healthy? And most of the health testing should occur in the proactive region rather than in the reactive region. Once you have a heart attack, yes, you can go to Dr. Mani and get yourself operated, but that's not the way. You got to prevent from getting into a bypass situation. Can we believe that we are in the same level as United States? Yes, we are. We have full body MRI available. We have genetics available in India. We have advanced blood diagnostic available. We have biomic studies available. We have bone densitometer. We have CCTA, computerized coronary tomography angiography, assisted with artificial intelligence. We have early cancer detection. And we have wearables including iWatch and many of these Android watches also. They tell you minute-to-minute monitoring of your health status. I will concentrate a little bit on atherosclerosis because that concerns me. Begins early but manifests later. CT coronary angios are valuable. Paradoxically, more calcified the plaque is, lesser its potential to cause hemorrhage into the plaque and its structure. This in turn leads to acute and chronic coronary events. Person is less than 50% with very little calcium. He is the guy who is more susceptible to have a myocardial infarction. He is the Raju Srivastava. He is the Krishna Kumar. Rather than the higher calcium score. Softer the atheromos core, more the worry of rupture. Calcified plates are safe. If you have calcium score high, it is not a contraindication for a CT. This is a series of CT pictures which I am showing you, and this has been assisted by artificial intelligence. There is an organization called Clearly in the United States which organizes the CT angiograms, and this is what they tell us. And where is the trouble? The trouble is when you have necrotic core, and these are the people who can have high-risk plaques. When you have fibro-fatigue, you are halfway there. If you have fibrous, you're better off. If you have a little calcium, that's very stabilizing. And if you have more calcium, that's okay. And if you have a calcified plaque more than 1,000 units, that means that's not going to harm you at all. Now, going back, the whole talk about reversal of atherosclerosis, which I'll be talking to you shortly, is making this soft plaque into a hard plaque. Sorry. Now, what you see by artificial intelligence is when these arteries, now what you see on this picture here is the arteries have been straightened out. This is the artery which has been straightened out, and these are the plaques. Now, this is hemorrhage into a plaque. This is the soft atheromatous core, and this blue thing is the calcium. Now, in some of the arteries, there is calcium. In some of the arteries, there are don't have calcium. Now, what we see in the angiogram, in a coronary angiogram, is only this. We only see the lumen. We don't see what's outside, and this is what is the predictor of the future events. And we ignore it. We say that, did a coronary angiogram and I found all my arteries open, so I'm safe. What about the atheroma that is lurking in the walls of the coronary artery? And that is what artificial intelligence can pick up, and that is why I feel that CCTA is more valuable in aging than coronary angiogram. Now, this is how it is projected. Now, low risk, irreversible are the ones which are totally calcified, and this gentleman had only 21% totally calcified, and they are quite safe. But what is high risk is the soft atheroma, which is there, which is not causing luminal stenosis, which is still there in the coronary artery wall, and that can burst any time and cause myocardial infarction. And this is what we should care about. And this is what I'm talking about in aging, how we can prevent this from occurring, and we can advance into aggressive strategies. We have to go to both, cardio diabetology is one subject today. We cannot isolate treating atherosclerosis without treating diabetes. Lipid lowering, very well known to most of you, statins, ezetimibe, bempedoic acid, Repatha, and inclisiran. Repatha, evolocumab, and inclisiran, these are injectable drugs. They reverse atherosclerosis in a much aggressive fashion than what atorvastatin can do. I'll show you in some next slide. Our old good friend metformin is a geotherapeutic agent which attenuates the biological hormones of aging. There are newer human and synthetic insulins, SGLT2 inhibitors of various gliptins. We know that they are getting better and better. Ozempic is a semaglutide. It's an injection which can really control diabetes in a very big way, and it helps in reduction of weight. Cholesterol metabolism is familiar to this crowd. We have various types of blockages by which we can reduce the cholesterol in our body. I rush through this because it's well known. Reduction of LDL cholesterol is the basis of cardiology today. Reversing atherosclerosis. Now please pay attention to this HDL, the pre-beta HDL. Now if you have enough pre-beta HDL, you are safe. If you don't have enough pre-beta HDL, That is, if your pre-beta HDL is low and your HDL otherwise is high, EHDL, then you have a high risk of atherosclerosis. Whereas if you reduce your high HDL and increase the level of pre-beta HDL, then your arteries remain open for a long time. How do you do this? Now this is apheresis. Now apheresis means in Greek to take away. There are many methods of rejuvenation, and one of the methods is therapeutic plasma exchange. The plasma is taken from the patient, it is withdrawn from the patient, it is filtered and enriched with this beta HDL and put back into the patient. What you see in the center is a machine which can do that, and this is the first plasma bag which is collected, which has got very less of pre-beta HDL, and we've got more of these other HDL. And then we reverse it, change it to plasma, and you have more pre-beta HDL in the bag that is reinfused. That is how you can reverse atherosclerosis. How much do we reverse? What you see on the right side in this graph is what atorvastatin can do in 2.2 years. And this is what plasmapheresis can do in 7 weeks. The reduction is more than 3 times. So this is comparing with what we are already having and what is good can be available. And the same thing, we see that the efflux treated is also significantly better with plasma therapy. Now, the possible logarithm of the near future is unstable angina or stent, okay, don't worry about them, send them to us, we'll fix it. But if you have stable angina, you have a big option. You can discuss and you can reverse atherosclerosis, and that is what will improve your aging. How much time do I have?
5 minutes.
Oh.
5.
I won't be able to finish in 1 minute. I'll take 2-3 minutes extra.
Yeah, allow him.
Now, endogenous insulin is, what we secrete insulin all the time, and the transcription factor. That is what changes with the gene, and that is what is causing our obesity factor. And I'll rush through this because leptin is something that we are all very familiar with it, which is the satiety hormone. That you eat enough, you have fats in your stomach, and there is a signal going to the brain which tells you you've eaten enough, don't have to eat anything more. But what happens is this leptin is somewhat curtailed. This is how insulin resistance develops, and there is a STAT3 signal which gives alternative signal, and thereby you tend to eat more than what you should eat. I'm sorry I'll have to rush through this. Obesity, why should we avoid obesity? Obesity, including me, I'm also obese, but obesity causes oxidative stress and inflammation, which may increase the rate of telomere shortening. And this is what I was telling you, this is what causes aging. Physical activity may protect telomere lengths. Increased BMI is associated with altered methylation of DNA. Obesity, insulin resistance, and atherosclerosis, this is the killing triad. More important than calculation of BMI is the calculation of the total body composition, because total fat content is total inflammation. There are MRI, whole body MRIs which can be done, accompanied with artificial intelligence, which will tell us our fat composition, which is going to harm us. Calorie restrictions and epigenetics. Calorie restriction clearly retarded the methylation drift. Methylation of DNA is aging. If we can do that by calorie restriction, why not? Excessive nutrient consumption causes the metabolism to shift towards lipid storage and glycolytic ATP synthesis, which concurrently decreases mitochondrial biogenesis. No mitochondria, no life. Mitochondrial ROS production leads to hyperglycemia and adipocyte mitochondrial dysfunction. These modifications contribute to insulin sensitivity and also reduce oxidation of fatty acids. This leads to less defined internal membranes, dependence on glucose for ATP synthesis. Depending on glucose for ATP synthesis is not a good thing because you end up with more fatty acids. Excessive food intake upregulates apoptotic pathways, which along with cellular senescence could stop DNA replication and cause stem cell exhaustion. These are the methylation clots. We are short of time, so I won't refer into this. You are only as old as your arteries. Your arteries are old, you cannot be young. So if you want to remain young, keep your arteries young. This is the genetic parameters of aging. There are many methods. These are all gene studies on the basis of which we can understand. An important area is microbiomics, the gut biomics. And there, if we can understand that there are trillions of bacteria which we carry in our gut, and if we carry the wrong type of bacteria, we can have problems in our aging. Detection of preclinical cancer. Tumor shell is shed nucleic acids into the blood and other body fluids. It is not necessary that we have to wait for a tumor to occur. If we do a blood test, we can understand that there are fragments of DNA which the tumors have left as their mark. It is just right in the beginning of genomic studies that we can detect cancer much before it actually surfaces. Whole body MRI, cancer stages in 1 and 2 has much better life expectancy, doesn't have any radiation, there is no exposure to radiation, and there is a good... This is the last 1 or 2 words about stem cells. Stem cells are the cells that we are all born with. When we are born, we have a large number of stem cells. That is why if there is we do a lot of neonatal surgery. When the child gets better, after they don't even have a scar, that is how the healing is. That's because they have high stem cells. As we grow old, the stem cells go away. Placenta is a natural stem cell biorefinery. We just throw away the placenta. There are a lot of stem cells here which we can use and reuse for repair and regeneration. Regenerative therapy. In stem cell therapy, the donor stem cells are placed in the body to replace and repair. On the other hand, exosomes are extracted from the mesenchymal stem cells and sterilized. Exosomes have got better cell-to-cell communication. They have anti-inflammatory, anti-fibrotic. They are easy to administer. Exosome-based liquid biopsy detect tumor cells much before they surface. And they are found, you can detect exosomes in the blood and saliva also of patients. Lifestyle changes, willpower to overpower inflammation. Ladies and gentlemen, it is inflammation that is going to kill us, and inflammation can be prevented by, we all know this very well, we are from the land of yoga, and the Prime Minister has reiterated the importance of this, but we all tend to ignore. Exercise is the main thing. Fasting 12 to 16 hours a day. It's difficult to begin with, but it is possible. I do that today, and it was difficult when I started. Low glycemic index foods, including what we are going to get at our lunchtime. 6 to 8 hours sleep. Hot and cold exposure. I didn't know this. If you are exposed to hot baths, if you are exposed to sauna every day, it helps you. Cold exposure, immediately going to a cold room after a hot tub. Meditation, hydration, avoid food from animal sources. I'm not speaking on behalf of BJP, but as such, avoid animal sources. Keep the body weight, BMI maximum allowed is 28. After 28, you are running the risk. Watch out for new symptoms. If there is any new symptoms, investigate. Ayurvedic medicines are plenty available. I put a disclaimer that I don't have any knowledge in this. But yes, turmeric is a very common food that we use, and we use that haldi all the time. More in the South Indian food in sambar and rasam. Personalized medicine can shift the emphasis in medicine from reaction to prevention. direct the selection of optimal therapy and reduce the trial and error method of prescribing, help avoid adverse drug reactions, increase patient adherence to treatment, improve, as Dr. Arun said, improve the quality of life, reveal additional and alternative uses for medicines, help control the overall cost of your healthcare. You have to agree with me, your aging is in your hands. Thank you very much.